The contents of this podcast reflect the views and opinions of the host and do not constitute medical advice. Hello, welcome back to Long COVID MD. I'm your host, Dr. Zeest Khan, a licensed and board-certified physician navigating recovery from long COVID. It is the first episode of season 2 and the 13th episode overall. So it seems fitting that for unlucky number 13, we're going to talk about something unlucky that happened to me. I got reinfected with COVID recently. It's set me back quite a bit, and it's taken a good month to feel significantly better. It also impacted my existing long COVID symptoms. Today, I'm going to tell you my story of reinfection, how it's impacted my long COVID symptoms, what I'm doing about it, and we'll talk about the existing literature around reinfection in patients with long COVID. There's a lot to cover, so let's get started. First, I want to talk about the taboo that is reinfection. COVID, I don't have to tell you, has been an emotional topic for the world, and everybody's got an opinion on what it means to catch, survive, succumb to, or have complications from COVID-19. It is perfectly understandable to be worried about catching COVID. It is also very important to be concerned with spreading COVID. When you're like me and you have long COVID, the stakes feel even higher. But the fact of the matter is, all of our protective measures have a margin of error. The fact of the matter is, we live in community. We live in societies over which we don't have full control. I live in the US, which has an inconsistent public health policy toward COVID-19. Even with my limited mobility, I still have to interact with the rest of the world in order to get what I need done and to survive. All of that to say, I do not have full control over what happens to me. Catching a respiratory virus does not mean that I am irresponsible. It does not mean that I deserve to be sick. And it does not mean that it is my fault that my symptoms have gotten worse. Unless you've gone out of your way to lick an infected petri dish, I think the same can be said for you. If you have long COVID and you get reinfected, even if you've tried your best to avoid reinfection, I want to say first and foremost, it is not your fault. It is not something to be ashamed of. And it does not mean anything about you as a person or your ethics. It, of course, is something that's going to trigger grief. It can be very disappointing and very sad to get reinfected by a virus that has already caused so much damage in your life and one that you are trying to avoid. Grief, though, is different than shame, and I think it's the shame that I want to remind myself not to carry, and I want to remind you not to carry. I got reinfected with COVID, but I'm not sure when, I'm not sure how, and I'm not sure where. In the middle of March or towards the end of March, I was starting to feel a little run down. I can get run down like a lot of you can after exerting myself quite a bit, but I didn't have an identified PEM trigger, or there wasn't something that I had done that I could attribute a post-exertional malaise crash to. Nonetheless, I was tending to myself and spending more time in bed and resting, especially because I had a big trip coming up. So I had a pretty big trip towards the end of March to see a couple of specialists who are out of town. The trip took a couple of days, and by the time I came back, I was wiped out in a way I hadn't been in a really long time. That being said, that trip was one of the biggest trips I had taken in a very long time. So I attributed my crash to post-exertional malaise. And that very well might have contributed to it. In retrospect, I think an infection might have been brewing, because within a day, I felt a very specific tickle in the back of my throat. It is a tickle that I am familiar with, that is a warning sign of impending infection. I, like many of you, get a sore throat when I have a long COVID crash, but this particular tickle wasn't that sore throat. It was an indicator that I was getting a upper respiratory infection. All I could do at that time was hydrate and rest some more. But the next day I had full body aches. I mean, full body aches. Every one of my joints hurt, my wrists, the knuckles in my fingers, my ankles, even the knuckles in the joints in my toes hurt. I was laid out. Luckily, nobody else in the house had symptoms, but I knew that I had an infection. And within a few hours, I started not only getting worse body aches, but I developed a vice-like headache. A vice-like headache is common in aggressive respiratory infections like the flu. And actually, the last time I had this particular headache was when the H1N1 flu virus was going around. I was in residency at the time. I think it was in 2008, and it was one of the only times I had to call in sick. A vice-like headache is one that, sounds just like the word. It is a squeezing, intense pressure that it goes in like a ring around the outside of your head, from one ear across the front of your forehead to the other ear, and back around the side of your head to the first ear. When I got that vice-like headache, it reminded me of that time in 2008 when I had the flu. So the first thing I thought was, well, maybe I've got the flu. I didn't have any flu tests at home, but I did have COVID antigen tests. My thinking was, I'll take the COVID test, and if it's negative, like I expect it is, then I probably have the flu. By this time, I was already developing a fever as well, which is really typical for the flu. Now, I have taken so many at-home COVID tests that I just thought the stash I had didn't work. But this time, that pink line showed up so fast, so dark, that I had to admit I just didn't have COVID since 2020. This test was definitely working. So the first step to take after you find out you've been reinfected with COVID is to take a breath if you can and take a long exhale again if you can. It is a scary situation. It can be an emotionally heavy and draining situation, but panicking is not going to be helpful. All of those other emotions, though, are totally reasonable to have. What I tend to do, though, is focus on the task at hand and use what was available to me to help myself feel better. I wasn't even going to start going down the road of what is this going to do to my long COVID. What I focused on was getting through an acute COVID infection. In order to do that, I isolated from my family. I focused on hydration. I took acetaminophen or Tylenol to help with my fever and my body aches. And I got in touch with my doctor. I was eligible for and was prescribed the antiviral Paxlovid, and I started taking it the same day. There are 2 antivirals that are currently FDA approved for use by people who have mild to moderate COVID infections and who are at risk of developing severe infection. Those 2 medications are Paxlovid, which is what I took, and molnupiravir. Paxlovid is composed of 2 medications. One is an antiviral that deactivates the SARS-CoV-2 virus. The other drug helps the antiviral last for as long as possible in the body. It does this by acting on the enzyme that would degrade the antiviral. It's this medication, the one that works on the enzyme to prevent the degradation of the antiviral, that is both the strength and the limitation of Paxlovid. The reason is that same enzyme affects many other medications. And so if you are on one or several medications that act in the same degradation pathway, then Paxlovid might be dangerous for you. Paxlovid is also contraindicated in people with several medical problems, including kidney insufficiency. So you have to be very clear and transparent with your prescriber about your existing diseases and the medications that you're taking so that you can take Paxlovid, if it's right for you, safely. If Paxlovid is not available or right for you, the other option is molnupiravir. Molnupiravir is also FDA approved to treat SARS-CoV-2, and it acts to deactivate the SARS virus by a different mechanism than the antiviral that's in Paxlovid. It's not as effective as Paxlovid at preventing severe disease or hospitalization, but it is still found to be beneficial. It interferes with far fewer medications, and it is more easy to tolerate. Paxlovid can be a tough drug to tolerate because of its side effects. And I certainly experienced side effects from Paxlovid. It was still worth taking, but it wasn't easy. So I had a significantly changed taste in my mouth that was really bitter or metallic. It was so strong that it interfered with my sleep for some period of time. I depended on chewing gum, popsicles, and saltine crackers to get through that. I was chewing a lot of gum. I am not typically a gum chewer, but I had a stash next to me. Paxlovid is known to cause GI side effects. Of course, COVID infection itself can cause diarrhea and nausea, But for me, I think it was at least worsened by the Paxlovid. It was certainly timed around my Paxlovid doses. So I developed diarrhea that luckily resolved shortly after I finished my Paxlovid course. And I developed nausea that lasted long after the Paxlovid was done. That very well might have been caused or started by the COVID infection. I'll talk about that a little more in a few minutes. Paxlovid is also known to just make you feel poorly and worsen the malaise you might also already have from being sick with the reinfection. Nonetheless, I am very grateful that it was available to me, and I am happy that I took it and finished the course. So what do we know about these antivirals? Well, right now, Paxlovid is approved for patients who are at least 12 years old, who weigh at least 88 pounds, have mild to moderate symptoms from a COVID infection, and have at least one risk factor that increases the chances that they will develop a severe infection requiring hospitalization. What are those risk factors? Some are pretty obvious: pre-existing coronary artery disease or heart disease, some other heart diseases, lung diseases, including asthma, obesity, and an immunocompromised state. Some risk factors are less obvious, and they include a history of smoking, substance use disorder, mental health disorders like depression and schizophrenia, lack of physical activity, and pregnancy. Having a diagnosis of long COVID is currently not on the list of one of those risk factors, but chances are you have one of those risk factors if you have long COVID. That being said, there is insufficient data so far on how Paxlovid affects patients' long COVID symptoms, or if using Paxlovid during a reinfection reduces the chances that your long COVID gets worse. That being said, there are studies ongoing that are using Paxlovid as a potential treatment for long COVID. And while we're waiting for those results to be published, it makes intuitive sense to me that taking an antiviral for the virus that caused your initial infections is a reasonable thing to consider. But if you call your doctor, depending on how familiar they are with long COVID, and say, I just tested positive for COVID and I want an antiviral because I have long COVID, that doctor, if they're prescribing very strictly, might not consider that as one of the risk factors that make you meet criteria for benefit. In that situation, you may want to focus on the existing list of risk factors that you might have in order to fully discuss your options. I'm going to leave a link in the show notes to a list of all of those risk factors and at least one example of criteria for prescribing Paxlovid. And again, when I say meeting criteria, I mean meeting criteria for the FDA approved use of Paxlovid. I believe molnupiravir has the same criteria. I will have to double check. If I'm wrong, I'll put those criteria for molnupiravir specifically in the show notes also. So as I mentioned before, Paxlovid has been shown to reduce the chances that a mild to moderate COVID infection becomes a severe infection causing hospitalization. The jury is still out on whether using Paxlovid will reduce the duration of your symptoms. In my experience, I started feeling better after the first day of taking Paxlovid, and I dramatically moved in a better direction. My symptoms became much more tolerable, and I chalk that up to taking Paxlovid early. And speaking of early, the other limitation of Paxlovid is that it has to be started to be beneficial. It needs to be started within 5 days of your symptoms appearing. So that means if you want to assess all of your options pharmacologically, test early, contact your physician as soon as you do, and have that discussion of antiviral use so that you can get it prescribed in a timely fashion and you don't lose that window of opportunity. So by day 6, after taking 5 days of Paxlovid, my respiratory symptoms were much better. My body aches were improved. I definitely still had head congestion, but the malaise and the fever were gone. Something else, though, popped up in its place, and that was a flare in my long COVID symptoms. Symptoms that had been really well controlled for quite a while reared their heads again, and I'll tell you, it was scary. It made me angry. It made me sad. It was disappointing and discouraging, and it still is, although I am optimistic that I'm going to continue to get better. Before I share the details of how my long COVID flared, I will also share how I've remained optimistic. And it was the moment after I sort of felt the most sad. I realized that I was getting the same symptoms that I had in 2020 and 2021. I had to face the fact that I was sicker now with my long COVID symptoms than I had been in a very long time. And that caused me to be quite sad and discouraged. But when I reframed that, I remembered that that means I've gotten better. I haven't felt this bad since 2021 because I've been steadily improving. And so that gave me hope. And it also gave me the starting place on how to approach recovery this time around. But before I get ahead of myself, let me tell you how my long COVID flared. First of all, and most profoundly, and not surprisingly, the fatigue, that deep bone level fatigue where you feel like you don't have a single ATP molecule left in your body. The day I finally took a shower after being sick, I felt really good the first few minutes. As soon as I turned off the shower and opened the shower door, I realized I didn't have enough energy to get from the bathroom back to the bed. I just wanted to lie down on the floor. I was utterly exhausted. Related to that, I had strong bouts of post-exertional malaise from very minor activities, or what I would consider minor activities. Again, it felt familiar and I had been here before. I didn't want to be here again, and yet here I was. Next, let's talk about my heart. I started getting tachycardia. My heart rate would jump without warning, but I also had positional symptoms and orthostatic intolerance. Unless I was very careful moving from a lying to a seated and a seated to a standing position, I would feel very lightheaded, dizzy, and have a racing heart rate. When I had the racing heart rate, or actually sometimes without a racing heart rate, I would get this sensation of a pounding heart rate. Like I could hear my heart beating, not just in my chest, but it felt like in my ear. I still haven't discovered what that symptom is called. And it's not, like I said, always, it doesn't always come along with tachycardia. It is different than a palpitation. It's also different than chest pain or chest pressure, although I definitely feel like that thumping in my chest, like when someone's turned on the bass, like real high. I had a worsening of my cognition and cognitive abilities. We can call this brain fog, but I think that's really minimizing. I think that this is brain injury and hopefully transient. But I had difficulty understanding instructions. I had real difficulty reading anything, so I just stopped trying for a while in order to rest and not stress my brain much more. I was sensitive to sensory input. The way I describe it is I feel like the world is suddenly loud and I need a quiet place. I need a dark space. And I need as little external stimulus as I can. I approach it the same way I would someone who had a concussion. Next, my sleep has been really disrupted. Sleep has been a big challenge the last few years. And it has been a top priority for me. I have put so much effort into improving my sleep. And I think so much of my recovery recently has been because my sleep is so much better. But now I'm having disrupted sleep again. I'm also like jittery and I have an anxiety type feeling in the evenings. I chalk some of this up to autonomic dysfunction. At least that's my sense. So I'm hoping that the therapy for my orthostatic intolerance and the treatments that I use for my tachycardia will help with this as well. Sleep deprivation is a form of torture, and of course, it makes our progress all the more difficult. Getting sleep, I think, is really key to recovery. I'm not saying anything new that you don't already know. Next big ticket item in my long COVID flare was my GI symptoms that I've talked about a little bit already. Like I said, my lower GI problems resolved pretty shortly after I stopped taking Paxlovid, but my abdominal pain has gotten worse and my nausea was really prolonged. I lost my appetite for a pretty long time and was just patient with myself to eat more nourishing foods as I could tolerate. I expect my GI problems maybe to be the slowest to get back to normal just because there is so much affecting our gut microbiome and the lining of our stomachs. I take so many pills every day. And in addition to that, there is a poor understanding of what triggers abdominal pain, what makes it worse or better. And it's really difficult, even though we know in general that we want to improve our gut microbiome. Practically speaking, it's hard to identify what is lacking in our specific guts and how to supplement that effectively. In my lungs, my asthma got worse. I started using my inhalers a little bit more. My whole airway was not in very good shape, and so I'm still doing a lot to optimize that recovery, using saline washes, using nasal sprays, and using inhalers. Apart from that, I had this sensation come back that I hadn't felt in a while, and I think it's air hunger, where you feel like you aren't getting a deep enough breath, where you feel like you know you're breathing, but it doesn't feel effective. I have heard some people say like my diaphragm's not working, and I don't think that's the case with me. I frankly doubt that's the case for most people, because having diaphragmatic or even hemidiaphragmatic paralysis is not a small thing. But this air hunger sensation is nonetheless there. I'm puzzled by it. I don't have an easy answer for that one. And the last thing I'll point out, which is not exactly long COVID, but I think related to the reinfection, is that I started losing my hair again. That was really frustrating the first time around, and definitely takes a toll on our confidence, and it's disturbing to see so much hair fall out and to see so little hair on your head. So I think that's going to get better. I just have faith. I'm using scalp massage. I use Rogaine. I'm happy to talk more about hair and skin and the physical changes that we go through. I think there is nothing wrong with a little bit of vanity, and the way we look on the outside definitely impacts the way we think of ourselves and our sense of identity. And seeing ourselves physically change so rapidly, while our function changes too and is limited, really makes an impact on our psyche and our mental well-being. So what am I doing with my long COVID flare, and how am I now? The way I approached my long COVID flare, like I said, was to reflect on what I did in the past that worked. This has been a long, arduous journey. I've tried a lot of different treatments, and many efforts have been either misguided, harmful, or just not helpful. Luckily, there has been things that have been helpful and have been effective, even if they're not helpful quickly or dramatically. So I fell back on the basics. Like I said, pacing became my top priority. And when I realized that my recovery had been set back and that my long COVID symptoms had flared, I canceled everything that I didn't have to absolutely do on my calendar for several weeks. The things on my calendar include doctor's appointments, treatments, even phone calls with friends and family, school events for my kids, and then activities that I do at home to support my recovery, like some exercises, which are really, really minor, but really help me. and like my daily routine. It's a small little life, but it's my life and it takes up all of my energy. What I did was I cleared my schedule completely for several weeks because I knew that my main priority would be to rest and I had to have very few distractions. That means I had to cancel appointments. I had to cancel appointments that I was looking forward to, but would exert or require too much energy exertion. I hate canceling plans, especially when they're with other people. Doctor's appointments are not easy to reschedule, but I did that. And then, there were a few social engagements that I had with people who don't have the best understanding of what I'm going through. And I got pushback on that from them. And I had to change the subject or find ways to navigate that conversation and really stick to my guns, because my therapy, my medicine was rest right now. That is what paid off in the past. Pushing through did me a disservice. And so I needed to focus on effective strategies and effective therapies. On that note, I took out my assist devices that I had been dependent on in the past. So there's a chair in my shower, there's a chair at my bathroom sink. I hold the walls when I walk, so I've become refamiliarized with the cool sensation and texture on my house walls. I ask for help from my children, my husband, and my friends so that I could make sure that my energy was protected and things that needed to get done for my loved ones were also taken care of. God bless him, I had to offload responsibilities, even though he carries the bulk of them. I offloaded the few that I carry onto my husband, delegated and outsourced responsibilities as best we could. I asked friends to take my kids to activities that they share. And I feel so lucky that at this point in my life, I can ask for those favors without shame or embarrassment. My support group is amazing because it has been edited very aggressively during these last few years. That has not always been a pain-free process, but I feel very lucky that I'm around a group of people who do care about me and who have insight into what I'm going through and have responded with a lot of compassion. And whenever I can, I try to return the favors or like that social credit, right? It's not just transactions. We grow together and we lean on each other. Sometimes the leaning is in one direction and sometimes it's in another. In addition to resting and pacing, I checked in with my doctors, told them about my worsened symptoms. We adjusted some medications and we just made sure that we weren't missing warning signs of something bad happening acutely. I am a trained doctor, but from early on, I realized I am not my best doctor. So I do rely on professionals to give me their objective opinions and insight and advice. Today, I am feeling significantly better than I felt since getting reinfected. I do feel like my body has been in a car accident. I feel very stiff. I have more body aches and pains than I did in the past. I work with a physical therapist, and we do gentle exercises for flexibility and mobility and a little bit of strength training. And those tiny exercises I missed when I was ill. In addition to missing those exercises, I think there was generalized inflammation from the infection. I have more joint pain now than I have in the past. My hands are swollen. My feet are a little swollen. So I think there's some generalized inflammation there. And then that's all exacerbated by spending a significant amount of time in bed or seated. It's hard to avoid that, but working with a physical therapist who is sensitive to my condition is so helpful. Like nobody can replace her. And we'll talk more about physical therapy and the role of physical therapists in an episode coming up. Beyond that, I think my long COVID flare, those symptoms are moving in the right direction all in all. I have scheduled appointments with specialists where I'm going to discuss my current state. Those are not for another few weeks at least. But between now and then, I'm going to continue paying attention to my long COVID symptoms. I'm going to continue to be very cognizant that I have, even though it's expanding, a more limited energy envelope. I also think I have less buffer room to push that envelope right now. So, like I said, I'm being very intentional with my movements, very intentional with my choices, and very intentional ultimately with how I use my energy. This is droll, boring work. They are not choices that I necessarily want to make. I don't want to miss activities. I don't want to go long periods of time without washing my hair. And yet it's what I need right now. And so the benefit outweighs the risks, and I keep that equation in my mind. And I keep this overarching goal in my mind that my priority right now is to slowly expand that energy envelope. And the way that I'm going to do that is the same, using the methods that worked for me in the past. The primary one is slow, gradual, and I'll hopefully move in the right direction. I heard someone with long COVID say a mantra that was direction, not speed. That really resonated with me. Another almost cliche is fall down 5 times, get up 6. And this idea that the boring work is the important work. These are all cliches. They are not solutions. But a big part of this recovery process is keeping our heads in the game and staying motivated and positive when we have the opportunities to. I've said before, I don't believe that you can be happy all the time. I don't believe that just by thinking positively that you can make miracles happen in your body. But we all know that physical feats of strength and endurance are tightly linked to our mental fortitude. And so I'm trying to stay positive and be open to what is available to me. And as I start feeling a little bit better, I try to integrate things that bring me joy. I also try to remember when I'm doing things that don't necessarily bring me joy that I am performing this act, even if that act is rest, because rest is a verb, it is an action word. I am doing these things as an act of self-devotion. And by doing this self-devotion, I am also serving those around me who either depend on me or love me. And this may all sound a little bit cheesy to some of you, but for some of you, I think it probably rings true. I think one of the worst things about this disease is being separated from my loved ones, even if they're in the other room. I don't have access to engage with them. And so I try to remember that by doing this hard work of pacing and rest, that I am optimizing my chances to re-engage with them. But enough about me. Let's talk about what the literature has to say about reinfection with COVID in patients who have long COVID. Sadly, but not surprisingly, there is not a lot of information. I'm going to link to a pretty nice journal review article by authors who are based in Greece, published in August of 2023 in the journal International Journal of Molecular Sciences, which discusses basically the prevalence and predicted prevalence of long COVID due to reinfections. But that doesn't talk about how reinfections affect patients with pre-existing long COVID. And for that, I turn to a research survey done by two, I think, grassroots organizations called Long COVID Support and Long COVID Kids, which I believe are both based in the UK. In August 2022, they distributed a survey online asking patients, both adults and children who had long COVID, how a COVID reinfection affected their long COVID symptoms. The study, of course, has limitations, but they asked some really important questions. About 500 adults answered and about 100 children aged 3 to 19. 80% of respondents reported that a reinfection made at least some of their long COVID symptoms worse. For 23%, it made all of their long COVID symptoms worse. For patients who reported that they were either in remission from long COVID or recovered from long COVID at the time they got reinfected, 60% said they got long COVID symptoms again. In this group, 40% of those said that their second bout of long COVID was about the same severity as the first time they had it. Among the remaining 60%, about half of those said long COVID was more severe than the first time, and then the other half said long COVID was less severe than the first time. This group asked some really important questions about demographics, vaccine status, and they tackled how the reinfection affected long COVID symptoms in a pretty elegant way. I think that we need more robust research in this field. We need more research like this. If anyone is listening from Long COVID Support Network or Long COVID Kids, please be on the lookout for a message from me because I am really looking to connect. This is really important work. I would still like to know, for those people whose long COVID came back or even got worse from reinfection, did the symptoms ever resolve? How many of these patients return to their baseline function? There are still a lot of questions to be answered. So tell me about you. How did reinfection affect your long COVID symptoms? How are you doing now? If you haven't been reinfected, do you worry or even perseverate about reinfection? Did any of the information or experience that I presented today change your outlook on reinfection? Reach out to me. Email me at longcovidmd@gmail.com. Follow me on Twitter at Dr_Zeist. Follow, subscribe to, like, leave a review for this podcast, and tell a friend about it. Help me get the word out. There's a lot more in store for season 2 of Long COVID MD, including interviews and testimonials from other patients. We have a lot to learn from one another, and I hope this podcast becomes one of the resources you can rely on. Thank you for listening to this episode number 13 of the Long COVID MD podcast. I'm your host, Dr. Zeist Khan. I'm wishing you well, take good care, and bye for now.